Thank you, NPEC, for inviting me to your study day today to talk about parents in the mortality review, engaging parents in the review of their baby's death and what we've learned in the UK. My name is Charlotte Bevan. I'm a senior research and prevention advisor at SANS, the Stillbirth and Neonatal Death Charity. I'm also the SANS representative on the Perinatal Mortality Review Tool, which we tend to refer to as the PMRT, and also our national audit programme, which is the Embrace UK collaboration. I deliver SANS training in parent engagement in perinatal mortality review, and I am myself a bereaved parent. My daughter Hope died neonatally in 2001. That's my email, and please do be in touch if there's anything I can help with after you've seen this presentation. So for anyone who's not aware of SANS and our mission here in the UK, we support anyone affected by the death of a baby, and we run over 100 peer-to-peer support groups across the UK. We work in partnership with healthcare professionals to ensure that bereaved parents and families receive the best possible bereavement care. And in that vein, we are leading on the National Bereavement Care Pathway here in the UK. And we also promote improvements in practice and support research to help reduce the number of babies dying. And our work in perinatal mortality review is part of that third aim. So in today's session, I'd like to cover why perinatal mortality review is important, why engaging parents in the review of their own baby's death is so important, SANS 6 key principles of meaningful engagement, and how we've embedded those principles in the perinatal mortality review tool pathway and resources that I have helped develop as a SANS representative. I'm also going to show you some insights from parents that we've had and what their experiences are, in their own words, of the review process as it exists here in the UK today. So why is perinatal mortality review important, and why is engaging parents in the review of their deaths important? Well, this is a slide you may have already seen multiple times today and at other times, the perinatal deaths in the Republic of Ireland for 2019. 360 babies were either stillborn or died neonatally in the Republic of Ireland. That is one baby every day, one potential tragedy for a family every day, affecting 700 parents each year and countless other family members, siblings and grandparents. It would be great if at this moment you could reflect on the process for engaging parents in the review of each one of those individual deaths, and what, if you are a clinician or somebody involved in delivering this type of care, what is your greatest fear or concern about engaging parents? These are some of the things that health professionals have told us. I can't answer parents' questions. We don't really know what happened. So therefore, why would I engage them? I can't answer their questions. Fear about approaching parents so soon after their baby has died, when they are dealing with lots of difficult decisions around postmortem consent, memory making, and talking about review is just another one of those things. I'm just going to give you a minute or so to think about, to jot down for yourself, not to share. Thank you for doing that. Perinatal mortality review is, of course, an important process for learning from deaths. For parents, it's to make sense of what happened and to give them as much information as possible about why their baby died. But of course, for systems and for healthcare professionals and services, it's about identifying improvements in care that may save future babies' lives. Evidence shows that engaging parents in the mortality review of their own baby's death actually improves the quality and the aim of perinatal mortality review. And that's because parents are at the center of their care. They have a kind of 360-degree perspective, because everything happens to them and happens to their baby. They speak to the midwife, they speak to the obstetrician, and therefore their views may add to the clinical picture. This is what the parents study in Bristol found, not just that parents were able to add things that weren't in the notes, so a conversation that was had, an actual interaction with a community midwife that didn't make it into the mum's medical notes, but also they found the parent study in Bristol, the research there, and that's a link to it at the bottom, they found that it actually focused the review meeting because it felt that the parent was kind of in the room, even though the parent wasn't in the room during the perinatal mortality review meeting itself. So it promoted an open and learning culture. For parents themselves, the review is the narrative of their child's short life. Because what we find at SANS is that a lot of parents certainly have questions, but one of the things they will do almost instantly is blame themselves. Is it something I did? Is it my fault? Was I too stressed? Did I have a glass of wine too many? It'll be something that they will take on the responsibility for. And of course, in the absence of knowing what happened, that will generate distrust in the systems. Was it someone else's fault? Did someone else do something wrong? Understanding what happened in that individual case is really important for that individual family, because they will be planning, many families will be planning a future pregnancy, and the review may have implications for how that pregnancy is managed. We hear from many of our parents that there's an altruistic drive for being engaged and sort of fully informed and aware of what's happening with review, is that they want something good to have come out of something bad, so that the death of their baby is not just sort of a meaningless tragedy, but that if there's a lesson to be learned, that it can be learned. And then there is the issue which we see at SANS, because we support so many parents who lost babies, not just recently, but many years ago. There is the aspect of preventing long-term harm for parents by helping them understand and make sense of what happened to their baby. And in that vein, I wanted to tell you the story of Chloe Baker, or at least get her to tell it to you in her own words. Her son, Solomon, died in 2010. And she came to me about 2 or 3 years ago, so 10 years or so after Solomon had died. She had been unable to go to work because she was still suffering anxiety issues associated with the fact that she didn't really know why Solomon died. She was in a low-risk pregnancy. She was 34 weeks. She was going out with a group of girlfriends when she began to feel sick and have diarrhea. And she called up her unit, who said, "Come in." And she did, and she ended up having a crash C-section. And I will let her pick up the story, but from the point at which she was in the hospital, and just to warn you, it is upsetting. But this case presentation too is the review she had. This is what she was sent. So I think you can appreciate it's in quite a lot of medical jargon, in shorthand, not necessarily in plain English that Chloe and her family would understand. So here is Chloe picking up the story about what happened that night when Solomon died.
Then I can remember being taken on a trolley down to the operating theatre, and then I can remember anaesthetist on my left and the doctor above me looking at the anaesthetist saying, "Tell me when, tell me when, tell me when." And then the next thing I know, however many hours later, I'm coming to, and I can remember reaching down and saying to Simon, "I think my waters have broken." And that's when Simon had to tell me that he didn't survive. And yeah, and then it started. I just wish we could have had a debrief, one where we could all learn, where we could have figured out what happened. Because he was fine. He was absolutely fine before going into hospital. I was absolutely fine. I just had a bit of sickness and diarrhea, but something happened. Something went wrong. We've never had a written explanation or of that paragraph. I can't explain, because it impacts me daily with my job, my patients as a parent, my emotional state. Sometimes it can hit me in the middle of a supermarket. It would make a huge difference to find out why. and the changes that are now in place. I think I'd find a lot of comfort in knowing that this wouldn't happen again because X, Y, and Z are in place now. And unfortunately, it does still happen, but this is in place to help those parents that do go through this now.
So the recommendation is to engage parents in the review of their baby's death. And this is the potential implementation of that recommendation, which is a PMRT, what we have in the UK as a PMRT, parent pathway, but could be used anywhere. We developed this within a subgroup of the PMRT. I chaired the group. It was multidisciplinary, and at least half of the members, including some of the clinicians, were bereaved parents themselves. It was essentially a co-production of what we'd heard through parent surveys at SANS over the 40 odd years the charity has been in existence, learning from evidence. The parents study at Bristol, which looked at optimum sort of gold standard parent engagement in mortality review. And as well as best practice, there is was a pilot, it's now being actually delivered in Scotland generally, is something called the Being Open pilot. I think you would call it open disclosure in the Republic of Ireland. But this led to the parent engagement flowchart and resources that I'm about to outline for the PMRT, and that are available from the PMRT website, which I'll also give you a link to. So just to give you a sense of how important parents' perspectives are as far as the PMRT is concerned, it's the tool is an online tool that you fill out with all the information about what happened, that you extract from the clinical notes that are then discussed in the perinatal mortality review meeting. The first question the tool will ask you is, have parents' perspectives of their care been sought? And that will include just the question, were they told the review was taking place? Because a lot of parents aren't even told the review is taking place. And were their perspectives of their care sought? We created a flowchart to make this process implementable, possible to implement, and that is the link to it. But I will be sharing this slide set with you. They will be available on the IMPEC website for a while afterwards, so don't feel that you need to scribble down URLs or anything. It looks like that image on the left. It's a coloured chart. It probably prints in A3. What we hoped was that units would laminate it and put it somewhere that was easily, easy to see, easy to refer to as and when. But in sort of more microscopic detail, this is what that week by week flowchart looks like. And in those early hours and days before hospital discharge, of course, the first important thing is to provide bereavement support in the maternity or neonatal care unit. And we do say that a face-to-face explanation of the perinatal mortality review process should be done before the family actually leaves, with some written material about what the review is. We also outline what sort of type of sort of ongoing contact the unit should have with the family. And we describe something called a key contact, and that's in bold, that description, because it'll hyperlink to a document that describes the skill set and responsibilities of the key contact. The flowchart goes all the way through to weeks 4 to 16, when the final review is finished and the findings shared with the family. I won't go into too much detail about every single aspect of that, but suffice to say, what we promote is that it should be flexible, it should be open, it should be parent-centered, and that not all parents will want to engage immediately in the review process. They may not immediately know what questions and concerns they want the review panel to address, but that offer should be open throughout the process, and particularly for those parents who are hard to reach. We've added a document called flowchart notes, and this is just a couple of examples about what the flowchart notes include. And that was because when we tried to create the flowchart in the beginning, we realized, of course, there were so many anomalies potentially, challenges potentially when parents couldn't be reached, in definitions of things, in what we felt were sort of standards that couldn't be that, you know, key principles that should be kind of minimum care. And so we put it in some notes that you won't be able to print off and laminate and put it on the walls of your unit, but that you will want to refer to. And these are just a couple of examples. So for instance, that face-to-face discussion with parents about the review before discharge should not take place with a junior member of staff. It should take place with a senior member of staff. And also, you know, some guidance around looking at weeks 2 to 3. If after discharge parents can't be reached after we've recommended 3 phone, email attempts, then there's a letter that we've templated called When Parents Cannot Be Reached, which includes very sensitive and we hope language that will make parents feel more comfortable about engaging with their units in this process. So we have essentially created quite a lot of template resources as part of the pathway, the flowchart as we've called it. And mainly because what we find from a parent perspective is that the language is just so important and it can act as a barrier or a facilitator to engagement. And you may know yourselves from working with parents is that they will remember the language that's used for potentially forever. I mean, of course, parents are in shock when their baby dies. And we do often say that parents will need to be reminded of what's available and reminded of, be signposted to support and reminded of the processes. But it's also true that parents in that state of shock can have very vivid memories of things that were said. So we've created a template information leaflet that explains the perinatal mortality review, what it's about, what will the hospital be reviewing, why is the hospital doing it, and those template letters that I mentioned about keeping in touch. Because one of the things that we have also found over the years is parents feel very abandoned if they have to chase hospitals for results of reviews that they have engaged in. I'm sure you do this very well in the Republic of Ireland. It doesn't always happen in the UK because I think there's such a strong concern among clinicians that saying sorry to a parent when their baby dies is effectively admitting legal liability for the death of that child. SANS has produced a statement, and it's again available on our website, and in fact also on the PMRT website, and it's called Saying Sorry is Not a Blame Game. And it's really to protect clinicians to say, look, the GMC and AMC guidance is very clear about the fact that this is apologizing to a patient does not mean that you're admitting legal liability. What we know from parents themselves is how important that word sorry is, not even just from clinicians. Sometimes parents don't hear it from their own friends and their own family. It's simply an expression of human empathy and compassion at a devastating time in a parent's life, and getting used to saying it is a really important skill set. Another template that we've created for the PMRT, a resource we hope will be useful, is a feedback form that could be given and shared with parents, not necessarily to be filled out, but to trigger their thoughts about the fact that they might have questions and concerns that they want to raise and they want the perinatal mortality review team to address. Because parents may not exactly know what you mean by engaging with the review process. So these forms sort of outline what we're saying is, we want to know, do you have any questions and concerns about your care during pregnancy? Maybe you have concerns about your care during the birth of your baby, or even care that your family received after your baby's stillbirth or neonatal death, because I'm not too sure what the audit and review system does in the Republic of Ireland, but certainly the PMRT will also review the quality of bereavement care that parents receive and postnatal care too. And what we find generally from parents is you will hear both the positive and the negative about care. We've also created some plain English guidance within the resources, because what we found through our own national audit and our confidential inquiries, looking at some of the letters that parents receive after the findings of the review have concluded, they are written in quite insensitively technical language that acts again as a barrier to parents feeling engaged in the process. So we've done a sort of translation service. I did this with a neonatologist, an obstetrician, and a midwife, just to look for what are the most common sort of clinical scenarios that may occur, and the translation of those scenarios. So you know, your baby's brain scan showed findings consistent with intrapartum hypoxia. You know, that might be what a neonatal consultant might say, but a parent will find it much easier to understand your baby's brain scan shows signs of damage relating to a shortage of oxygen during labor. This is really important because I said earlier, I think, is that this narrative you give parents is the only narrative they will have of their baby's very short life, and they will be sharing it with other siblings and with family members and friends. And if they can't translate it if you can't translate it to them, they won't be able to translate it to their wider family and friendship group. And therefore, and it is something historic, I mean, I spoke to somebody the other day who was in her 30s, but whose sibling had died neonatally, and she didn't know why. Her mother had never explained it to her. So it's an ongoing family history that people for generations will, you know, may discuss and talk about. So essentially, it sounds, we say that parent engagement and review is a process of continually listening and informing, an iterative process of doing that, from informing the parents that the review is taking place, listening to their questions, their needs, and their story. Some parents may not have questions, they just want to tell their story from their perspective. Informing them about the process, the timings, are there delays, taking in any new concerns or questions when they arise, and then, of course, informing them of the summary findings and listening further on about whether they have any questions or their feelings about the final summary of the review at that point, because, of course, there isn't really entirely closure for parents. There may be, from a unit perspective, you've reviewed the death, you've audited it, it's in your systems, you feel like you're learning from it, but of course the parents still have to go away and kind of integrate this event into their lives. Just to reiterate again how seriously the PMRT takes the issue of parent engagement. If you say no to that first slide I showed you about the first question that comes up in the PMRT tool, you know, no, we didn't tell the parents, and no, we didn't ask them for their views about their care, it does generate an issue that requires a smart action. So the tool makes it possible to constantly audit your own care and how you're doing, and to respond with actions that are measurable. So we were very keen at SANS to understand, having helped supported the development of this pathway and these resources for the PMRT, knowing how poor this had been in the past, we were very keen to understand whether parents' understanding and experience of review had improved in the UK. Because at the moment, all we have is, in terms of lots of data, we have a sort of big picture data, we have is the perinatal mortality review tool annual reports, and that collects all the information that's put into the tool over the course of a year. And the third annual report, because the PMRT was rolled out in 2018 in the UK, that last report was reported last year, towards the end of last year, and we have seen an incremental increase and improvement in the number of parents who are told about the review, which is now reported as being 90%. Parents' perspective sought, 84%, and parents who raise no concerns with care, 40%. But we still hear on the SANS helpline and through our support groups and on our social media that parents don't all have an equitable experience of review, and many still struggle with in their relationships with their hospitals after their baby has died. And we wanted to try and capture in parents' words, and not just in the information that's filled out, after all, by healthcare professionals at unit level within the PMRT, whether the care that's being imagined as having been delivered is the same as the care that's experienced by parents themselves. So we ran a survey last April. We asked parents to respond who'd lost a baby between 2019 to 2021, so we could realistically capture the experience of parents who had potentially been supported in their engagement with the engagement pathway and resources that we provided within the PMRT. We got 278 responses from across the UK. They were reasonably representative in terms of ethnic minority groups. They were mostly mothers, and they were mostly parents of stillborn babies, inevitably. And what we found was that not all parents are told about review. It's still only 6 in 10 parents in our group, the 278 who responded. And in a way, more interesting for me was the fact that while 6 in 10 were told about a review taking place, 1 in 5 of those 6 didn't entirely understand what a hospital review entailed. So there was still this gap in delivery of the information, and therefore in parents being able to make informed choices about whether they wanted to engage and whether they had questions. This is a mum from Scotland whose baby died neonatally. She said, "I never knew about a review until I reached out at the breaking point to a bereavement midwife in my own area. We have no doubt that our care was amazing and that the hospital did everything they could for our baby. However, a review would provide some kind of closure. I also wanted the review to look at why it happened and give us some insights." So it's interesting that she's not looking to blame the hospital for anything. She simply wants to feel that the death of her baby is in some way meaningful to someone. I'll give you a link to the report that we produced as a result of this survey, but just one more finding from it about satisfaction and feeling listened to among the group of parents. So as I said, not all parents knew that review was taking place. Most of those who were told the review was taking place were also given the opportunity to present their questions for the review panel to assess. And 8 out of 10 of them did have questions, but not all of them felt completely or entirely listened to. 6 did, but there were 1 in 10 who didn't feel listened to at all. And of course, that has the potential to create more harm for parents when you engage them in a process, but the process is not meaningful enough, that actually all you do is create another barrier and another sort of aspect of harm to a family that is already harmed by the death of a baby. And what we found was that being listened to was very strongly associated with parents' overall satisfaction with the review process, with only with as many as 4 in 10 parents saying they were not or only quite satisfied with the review process. What was really key for this piece of work, this survey that we did last year, was also identifying where care was good, because those, in a way, that's the message we want to seize on, where it looks good and why it looks good in the way it does. And I think these quotes really resonate in terms of how powerfully positive that engagement can be when it's got right, when you get it right. I feel like every care has been taken to ensure I have all the information needed about my baby. I still don't have any explanation as to why he was stillborn, but I've been assured that there will be more support available to me during a next pregnancy if I'm lucky to have another baby. Another mum said the hospital was brilliant and we were given lots of opportunities to ask questions. Even now, almost 5 whole months on, we feel we could call them to talk about things again. And I think that is amazing. You don't see that a lot in the UK, which is the sense that the door is still open, that if you still have questions, you still have concerns, we're still here, we still care, we still care about, and sure as eggs, you may be supporting that mother in a subsequent pregnancy. So keeping that door open is even more important, because her experience at this stage will have an impact on how she approaches a subsequent pregnancy. And this quote, the review made us feel that people cared, that it wasn't just one of those things, I think just sort of sums it up incredibly simply in a single sentence. So we've embedded that learning in our 6 principles for parent engagement, and they are almost self-evident, about timeliness, about being informed, both the healthcare professional delivering the engagement being informed as well as the parent being informed, parent-centered, because I actually did a training session this morning with a group of healthcare professionals who said that we're really struggling to get hold of some parents because English wasn't their first language. So those are challenges that you may face in your units, and you may have to think of ways around how you're going to deal with translations of very sensitive subjects and engagement. Easy to access and flexible. Again, this morning in a training session I did, there was an issue around they wanted to have a meeting with the parents. They wanted to do it via Teams and Zoom, but of course there might be issues to do with digital access and technology. So it's about making it as parent-centered and as flexible as you can. compassionate and gentle, of course, goes without saying. And when there are issues to do with open disclosure, it's essential that you are honest about anything that you find. Because when things go wrong, it does present challenges. What we find at SANS, however, is that if you get that communication right, it will reduce escalation and complaints. Most parents we speak to at SANS escalate things to litigation because they feel that their hospital is being defensive in some way, or is refraining from giving them information. So in some instances, it's just a question that the hospital is too busy, there's too much going on, there's COVID, there are huge amounts of challenges for frontline healthcare professionals. But an absence of information, and therefore they haven't communicated with parents, but an absence of communication for a parent suggests that somebody is trying to hide something. That's how they will read it. I also just wanted to let you know about 2 studies. Again, I'll be sharing these slides, so you don't need to scribble these URLs down, but 2 studies around open disclosure and good parental engagement and review that SANS is involved in, that I think will shed a lot of very useful evidence around how we could do this better and how we could mitigate this sort of comment. This is from a mum who responded to our survey last year, who said no follow-up or update on changes they claimed they would make. They refused to acknowledge their mistakes, killed my son. So that's very, very dramatic, impassioned, tragic language. And this is what we are trying to avoid, a sense of that a parent, a family going forward in life with that feeling. So I hope that has been useful. I just thought maybe at this stage it would be a helpful exercise just to reflect on how meaningful your pathways are, the ones that you're using now, if you are indeed implementing parent engagement and review, and whether they can be improved by anything that you've seen. And also whether that fear or concern you might have jotted down right at the beginning, whether that's still there. Is there anything I have presented in terms of a resource or a comment or the video of watching Chloe that has made you feel, actually, do you know, I think I could do this a bit better, or I no longer worried about that aspect. That's going to be fine. So I'm just going to give you another 30 seconds, minute or so, just to think about that, if that's okay. So do continue to think of that while you're watching this following animation. So we created this animation last year. Again, we've only just launched it, and we've created it as a tool for healthcare professionals delivering parent engagement in the review of their baby's death, to sort of explain in very simple language what we mean and why it's important. It's called a unique perspective.
Parents are at the centre of their care during pregnancy, labour and birth. They will have a unique perspective of everything that has happened to them leading up to the death of their baby. Following the death of a baby, parents will be grieving and in shock. Many parents will be weighed down by lots of questions. Understanding the cause of their baby's death will be important, not least because it may have implications for a future pregnancy. Not knowing what happened to their baby may have an impact not just on parents but on siblings and the wider family too. That impact may be lifelong and affect their ability to cope with everyday life. Parents will need support to understand what review means and to know that they can ask questions and share their own version of events. They will need guidance from healthcare professionals so that they have the confidence to know no question or concern is irrelevant. Even small details can play on a parent's mind for a long time and are an important part of the bigger picture. It may be too soon for them to think of all the questions they have now. Giving them written information to take home about the review process and how they might be involved is important. Answering parents' questions and giving them the chance to tell their version of events as part of a robust hospital review supports them and their families growing through their grief. And if things have gone wrong with hospital care, an open and honest review will mean fewer parents resort to litigation to get clear answers. Clinicians who engage parents in review say they provide unique insights into where there are gaps in care that would otherwise be missed by the review team. Listening to the voices of parents not only helps parents and families move on, it improves care for future families and saves lives.
So I hope that that was a helpful animation. I think just to link it back to Chloe, you know, one of the questions that she had was about why they had to remove her earrings before a crash C-section. So some of the questions aren't about what happened to my baby, why did my baby die? They're about some of the processes that you might have in place that have, you know, have clinical implications. They're processes, they have to be done a certain way that parents don't necessarily understand. And all they can think about afterwards is why was there a delay? So for Chloe, the question is, why did you tend to spend time removing my earrings when my baby was about to die? So it's the resolution of some of those questions that parents need. So I think it's really important to highlight that, of course, it's you out there who are at the front line of doing this type of work. And we don't at SANS for a single second underestimate how challenging this work is, and that it often falls on individual people time and time again within services, and that those people really need support, because this is very resource intensive, it's very emotional, and getting it meaningfully right takes training and takes time, and that will have an impact on staff. And we very much hope that the leadership chain and the way hospitals are governed and run takes into account the impact some of these types of communications have on their staff. But if they're not, and you need to reach out to us, we are here for everybody who's affected by the death of the baby, whether delivering care, or they're a parent or a family member or a friend, and that's our helpline. So please do call us. You can't, remember, you can't pour from an empty cup yourself. So thank you so much for listening today. I really appreciate being invited to speak to you. Please do sign up for our e-bulletin. The link is there. Do follow us on Twitter. And I also just really want to say thank you to Chloe. She's not here, but to kind of name check her, because and also to say, because when you see her in that very upset state, it is quite upsetting. I just wanted to say this is her last year as well. So we did the film last year, but towards the end of last year, she also ran in the London Marathon, and that had been an ambition of hers since Solomon had died, but she only managed to do it last year for various reasons, with her 2 other sons born after Solomon, her husband Simon. So thank you to Chloe, and thank you so much everybody for inviting me here to speak today.